Today, I'm going to tell you how your legs and feet can warn you about your health.
Do you know that your feet can give you early warning signs for many of the most life-threatening illnesses that affect seniors? Many diseases like heart attack and dementia can show early signs on your feet. Today, Dr. William Li will be exposing these signs to us. Dr. Li is a world-renowned Harvard-trained medical doctor, researcher, and president and founder of the Angiogenesis Foundation. His work has led to more than 40 FDA-approved therapeutics and devices for notable illnesses.
So, I'm an expert on circulation, and what I'm going to tell you today will help you pay attention to what's going on in your legs.
In today's video, Dr. William Li exposes 5 important warning signs on your legs you should never miss. They might save your life. The first warning signs is leg cramps.
A sign that something's going on with your legs and feet is when you've got cramping. Now, we've all had cramping before, but I'm talking about the cramping where you just walk like 100 yards and all of a sudden you can't walk anymore, like you've got this terrible cramp. And it can get worse and worse where you then walk even 100 feet. Or if you were in a shopping center from, one part of the store to the next, you can't actually continue because you get terrible muscle cramping. That's actually not normal. That's a warning sign that you're having blood flow problems right in your legs. Without enough blood flow, your muscles cramp up, all right? And you got to stop. So cramping is one of those warning signs, telltale warning signs that there is something actually going on because your muscles are carrying around your frame. They do a lot of work. And then when you're actually walking around, they consume a lot of energy. And if they're not getting that energy, they're not getting that oxygen, they're going to seize up and you're going to actually have a cramp. Now, this is the condition that's called peripheral arterial disease. Peripheral because it's not central in your body, all right? It's sort of in your periphery. Your legs are considered the periphery, your legs and feet for sure. Peripheral arterial, so this means that the arteries are getting narrowed, right? And disease, obviously. Now, this is not a local problem. People with peripheral arterial disease have a systemic problem, so it's narrowing of the blood vessels everywhere. These are the people that have narrowed the blood vessels in their organs, in their brains, so they can also have basically narrowing of the brain blood vessels, and that can lead to cognitive issues, memory problems, and in fact, ultimately vascular dementia. Vascular dementia is much more common in Alzheimer's disease. It's actually something that we see as blood vessels get hardened, okay?
Have you ever felt a sharp, aching pain in your legs while walking or climbing stairs? Do those cramps ease when you stop and rest? If yes, you might want to pay close attention. This could be a symptom of peripheral arterial disease or PAD. PAD happens when the arteries that carry blood to your limbs, especially your legs, become narrowed or blocked by plaque. This limits blood flow, especially during activity when your muscles need more oxygen. One of the earliest signs? Intermittent leg cramps. They usually hit your calves, thighs, or buttocks during movement and fade with rest. PAD is more common in older adults and those with risk factors like smoking, high blood pressure, diabetes, or high cholesterol. And here's the thing, left untreated, PAD can increase your risk of heart attack, stroke, or even limb amputation. But there's good news. PAD can be managed with lifestyle changes, medications, and in some cases, procedures to restore blood flow. So if you're experiencing leg cramps that come and go with movement, don't just brush it off as aging. It could be your body's way of telling you something important. Talk to your doctor, get checked, and take steps to protect your heart and your legs. The second warning sign is leg swelling.
Major swelling in your feet and ankles and into your calves, right? Now, swelling in the feet can actually happen for a lot of different reasons. Some of the reasons that are harmless are, for example, if you're on a long plane flight, so you're flying across the country, flying across the ocean to Asia or Europe, you're sitting there for a long time, right? That's called pedal edema, P-E-D-A-L, pedal edema, and that's particularly harmless. However, there are situations where edema can signify something really, really severe, all right? Lower extremity edema is what we call it, all right? Now, one of the things I told you about are these really fat, swollen feet and ankles. And now when you actually put your finger on it, pitting edema, it's like I said, like poking a piece of pizza dough, you'll see the hole where your finger was, and it will take a long time before it actually fills back out again, all right? And this can actually go all the way up your shins, all the way up to the calves as well, all right? You get that dimpling if you actually put your finger on it, all right? Now, so this pitting edema is actually not a normal situation, and it can actually happen when you have congestive heart failure. So pitting edema, all right, big fat calves, ankles, and feet, all right, might be a sign that you have congestive heart failure. And that's why when you have edema that doesn't go away, time to talk to your doctor and get some attention to it. You know, even though we're talking about the foot, that might actually be the tip off that there's something going on with the heart.
Have you noticed swelling in your legs, ankles, or feet lately? Maybe your socks are leaving deeper marks, or your shoes feel tighter by the end of the day. If that sounds familiar, it's time to take a closer look, because leg swelling can be more than just a comfort issue. It could be a sign of something serious, congestive heart failure. When your heart isn't pumping blood efficiently, fluid can begin to back up in the body, especially in the lower extremities. This fluid buildup is called edema, and it's often most visible in the legs and ankles. Why there? Gravity pulls blood down, and when the heart can't keep it moving, it pools in the soft tissues. This type of swelling is usually painless but can feel heavy or tight. It often gets worse as the day goes on and may improve slightly when you elevate your legs. But don't be fooled by temporary relief. Persistent swelling is your body's way of saying something's off. If you or someone you care for is experiencing this kind of swelling, especially if it's happening regularly, talk to your doctor. It could be an early sign of congestive heart failure, and catching it early can lead to better outcomes. The third warning sign is leg wound that won't heal.
Now, a warning sign that you should be aware of is when you actually have a wound on your feet that doesn't heal. Now look, most people, if you cut your feet on something, like step on a piece of glass, step on a nail, hopefully you had your tetanus shot, but let's say you cut yourself, what's going to happen? First, you're going to react in pain, ouch, pull your feet back, and then you're going to lift your foot up, okay? Put a bandage on it, right? And basically, as long as you keep that clean, believe me, if it's normal, a cut on your foot will actually heal up. But that's not the warning sign. The warning sign is actually when the wound that's on the bottom of your foot doesn't heal. In other words, the wound, you get a cut, the cut may not even be painful, but it's there, and it stays there more than a few days, more than a week. It's there 2 weeks later. What? It's not healing yet? This is one of the issues with diabetes. You've got a diabetic neuropathy, which is actually a problem with the nerves dying back. So diabetics have difficulty feeling the bottom, the soles of their feet. Very easy to step on a piece of glass, all right, and be cut, and you don't even feel it, all right? Now, one of the reasons that the nerves are dying back is that the blood vessels feeding the nerves are insufficient or they're blocked up, all right? Now, I told you that in diabetes, there's blood vessel problems, and those blood vessels feeding the nerves are not normal. They're dying back, and now without oxygen and nutrients, the nerves die back. And now you have an understanding of what diabetic neuropathy actually is. Diabetic foot ulcers are a common reason that doctors wind up amputating the feet and the legs of patients who have these chronic wounds. So you don't want to be there.
Have you or someone you know been dealing with a wound or sore on the leg that just won't heal? It might be more than just a stubborn injury. It could be a leg ulcer, and it may be a silent warning sign of diabetes. You see, diabetes doesn't always shout. It whispers through the body in small, persistent problems. One of those is poor circulation. When blood sugar is consistently high, it damages the small blood vessels that supply your legs and feet. Over time, this slows healing and weakens the skin, making it more prone to ulcers. In many cases, people with diabetes also suffer from neuropathy, nerve damage that dulls pain. So, they might not even feel a cut, blister, or sore developing. That sore can get infected and turn into a deep, slow-healing ulcer. Left untreated, diabetic leg ulcers can lead to serious infections, even amputation. The fourth warning sign is shallow, slow-healing leg wound.
Venous leg ulcers. It's also a kind of wound, but it's not like a diabetic wound, which is kind of round and deep. Venous leg ulcers are kind of, they can take any shape and not very deep. This is not a deep wound, but it can actually be a very large wound in terms of surface area. That could be a venous leg ulcer. Now, so let's talk a little bit about these shallow wounds that can form around your calves, near your ankles, on top of your foot, but it's generally sort of between your knee and your ankle. You have a problem called venous insufficiency, all right? Venous meaning veins, right? Arteries are the blood going out of the heart. Veins are the blood coming back into the heart. And the veins are insufficient All right. That's venous insufficiency, kind of like congestive heart failure. But in this case, the ticker is okay, but the valves in the veins are failing. Okay. They're insufficient. So this is called venous insufficiency. In venous insufficiency, it's really the superficial area, the thin part of the skin that wears down. All right. And a little hole will actually get bigger and bigger and bigger. Usually it doesn't bleed. Actually, it's just kind of like area of the skin that's breaking down. And venous leg ulcers start to form just because there's so much fluid.
Have you noticed a shallow, stubborn sore on your lower leg that just won't heal? It could be more than a skin problem. It might be a warning sign of venous insufficiency. Venous insufficiency happens when the veins in your legs don't work properly. Instead of blood flowing smoothly back to the heart, it pools in the lower legs. This buildup increases pressure in the veins and causes fluid to leak into surrounding tissues. Over time, this pressure can damage the skin, especially around the ankles. That's when shallow ulcers appear. These ulcers are usually red, irregular in shape, and may ooze fluid. They can be itchy, painful, or swollen, and they take a long time to heal. Left untreated, venous ulcers can get worse, leading to infection and even deeper wounds. So, if you see a persistent shallow sore on your leg, especially near your ankle, don't ignore it. It might be your body's way of asking for help. The fifth sign is black toes.
If your toes become black toes, all right, and I'm talking about black like burnt hot dogs, all right, and this again is a sign of peripheral arterial disease. This is the condition where blood vessels get narrowed or blocked, and now the tissue, in this case the toes, are not getting enough oxygen, and when it gets severe enough, basically the meat of your toes, the flesh of your toes, the muscle in your toes, the bone in your toes just basically dies. All right. It's just not getting enough oxygen. All right. And when that actually happens, when that tissue dies, it turns black and it'll actually dry out and you'll wind up getting gangrene. That's what it is when your toes turn black. So this is a telltale sign. If you wind up actually having black toes, you're probably having narrowing of the arteries elsewhere in your body as well. You got a problem not just of the toes, that's serious enough on your toes, but there's this is a tip off that you better go have the rest of your body checked out. So who actually does a checkout? Well, vascular surgeons are, this is their domain. This is their bailiwick. They're supposed to know. That's what they do, how to assess your circulation all throughout your body. But the black toes, that's a great sign to be able to pay attention to. All right. If you don't have enough blood flow to your foot, the toes can turn black. You don't have enough blood flow to your heart, you can get a heart attack. Not enough blood flow to the brain, you can actually start to lose cognitive power. You become dull as opposed to sharp, sort of mentally. That's not what you want. And that's the problem that's actually happening everywhere. Black toes, a clue you're not getting enough circulation to any part of your body. And in the toes, when the skin dies, it actually turns black. Now that black is called gangrene. And gangrene is a very dangerous condition because essentially not only does it tell you that your circulation is compromised all over, including your brain and your heart, but the fact of the matter is that eventually that gangrene can spread to the rest of your foot. All right, you might have to amputate your foot.
Have you or someone you love noticed a toe turning dark or even black? It might be more than just a bruise. It could be a sign of a serious condition called peripheral arterial disease, or PAD. PAD happens when the arteries that carry blood to your limbs become narrowed or blocked by plaque buildup. This reduces blood flow, especially to your feet and toes. When the blood supply gets too low, tissues begin to starve from lack of oxygen. This can cause the skin and tissue to die, a condition called gangrene. That's when toes start turning black. Black toes are not just a cosmetic issue. They're a red flag. They may be painless at first, but they signal severe artery disease. If not treated quickly, it could lead to infection, amputation, or even life-threatening complications. So if you see your toe darkening, especially if it's cold, numb, or slow to heal, don't ignore it. Early detection can save your limbs and your life. Will you follow Dr. Lee's teachings? Let us know in the comments.